You to a three-part speaker series about the Diversity Engagement Survey, or the DES. This session, entitled The DES, What is it?, will focus on the structure and use of the DES. Our speaker, Dr. Sharina Person, is a professor and vice chair of the Department of Population and Quantitative Health Sciences at UMass Chan Medical School. She is currently Associate Director and Senior Faculty Member in the Quantitative Methods Core, which provides consultative services to UMass Chan investigators in the areas of study design, sample size, power calculations, statistical analysis plans, statistical programming, data entry and management, and project coordination. Additionally, she teaches in the Clinical and Population Health Research PhD program, leads a course for the UMass Chan Health Science Preparation Program, serves as the Director of Summer Internships in the Division of Biostatistics and Health Services Research, and helps train new research investigators in Paraná, Brazil. She also serves as the Director of the Research Core for UMass Center for Health Equity Intervention Research. And she serves on several data safety observational study monitoring boards and an active grant reviewer for the NHLBI, NCI, and the Center for Scientific Review. Welcome, Dr. Person.
Good morning, everyone. Thank you so much for asking me to come and talk about the DES. I'm more than happy to do so, hopefully, at the end of this session. You'll know a little bit more about the DES, its origins, intentions, and how it may be of good use to both you in your departments as well as the institution as a whole. So let me share my screen. It's always iffy, even after close to 3 years of doing Zooms, whether or not I'll do this right. So let's see here. All right, hopefully you can see my slides. And so, oh, wait a minute, that's not right. Sorry, that's middle of the presentation. How about that? Let's start. See, I told you it was not a given that I was going to do this right. All right. Okay, hopefully the first slide that you see is the Diversity Engagement Survey. What is it? So for us to really talk about the survey, we need to talk about some of the terms that we're using. And so the first that would be helpful for us to have in our back pockets is what is engagement. And so by engagement, we're really trying to describe the connection between an employee, a staff, faculty member, and the goals of the institution. And so we're trying to really measure in engagement the employee's willingness and ability to contribute to the company's success or the institution's success in this example. And we're trying to get at the commitment and sense of belonging that a person has at the organization. We're trying to get to their commitment and motivation to really contribute to the organization's success. Do they feel like they're a vital part of the organization? If they feel like they're a vital part, they're going to go beyond just the kind of discretionary effort. They're going to go above meeting the minimum standards for the job. And do they feel like they're part of a greater entity? Those concepts are really what makes up engagement. And if you follow engagement literature, there are two types of engagement: engaging the mind and engaging the heart. Engaging the mind is what you really try to measure with kind of your traditional satisfaction surveys. We instead focused on engaging the heart. And the idea behind engaging the heart is if you can impact the heart of the individual, how they feel about the organization, really at not just a cerebral point of view, but how they deep down feel about the organization, they're going to be easier to retain. They're going to be more satisfied with their experience there. They're going to go the extra mile. They're going to feel like they're an integral part of the institution. So that's engagement. What about inclusion? Because that's another term that we've been using as it relates to the DES. And inclusion really is just a set of social processes that are going to influence an individual's access to information and social support. Do they feel like they have a support system that is fostered by their institution? Whether or not they feel they have license to help shape what are the accepted norms and behaviors at their institution, if they find security within whatever identity group they identify with or in their position within the organization, and whether or not they feel like they have access or the ability to exercise both formal and informal power in their organization. So I mentioned that we're trying to kind of group or marry inclusion and engagement research. And so the way that we did that in the DES is that our goal was to really understand how the institution's role in fostering both an engaged and inclusive environment. So we want our participants, our respondents, regardless of what station they are in, faculty, staff, students, we want them to feel engaged. We want them to feel included, that they have some license over their feelings of inclusion. And we wanted to understand that through the dimensions of diversity. So whatever dimensions of diversity that a person self-identifies as belonging to, we wanted really to capture their view of the organization's impact in inclusion and engagement. So that is the foundations of why we developed the DES. There was not, to our knowledge or to our satisfaction, an instrument that existed that really married that idea. So the DES was designed to capture data on member engagement, the inclusive characteristics of the organization's culture, and the degree to which diverse groups experience inclusion. So we found that the DES is best used if you're trying to build an inclusive culture, which seeks to try to retain, recruit, promote diverse individuals. If you're really trying to understand the level of engagement of your total workforce in relationship to specific diverse groups. You're trying to understand baseline strengths or areas of improvement for inclusion and diversity efforts. If you're trying to determine progress towards your inclusion goals in an organization's diversity plan. Many of our clients actually incorporate the results of the DES into their organization's diversity plan, and they measure how well they're doing based on retaking the DES. If you're trying to measure response to regulatory agencies, many academic medical centers actually use the DES and the results of the DES toward their diversity goals for LCME accreditation. As well as if you're trying to really kind of understand concerns that might arise as a result of historical baggage that people might have from stereotypes, economic constraints, and et cetera. Really kind of understanding the impact of those things is another good use of the DES. So the DES was designed to have three main functions. It's descriptive, it's diagnostic, and it's prescriptive. It's descriptive in that it describes the inclusiveness of the environment by really determining level of engagement by demographic categories. So you don't just have information as a whole, you also have information that's broken down by demographic category. And I'll talk about demographic category in a minute. It's diagnostic in that it defines areas of strength and areas of improvement for your diversity and inclusion efforts through benchmark comparative data. So one of the things that we always say is that you've seen one academic medical center, you've seen one academic medical center. And so part of the power of the DES is that we have a very robust benchmark data set that allows us to compare where we are to other institutions that are similar, not just overall, but by all demographic groups as well. So it allows you to really pinpoint specific areas that you can focus your attention, whether it be areas that you really need to focus on or others that you need to maintain, and it allows you to really marshal your resources more effectively. Finally, it's prescriptive in that it points to really strategic direction for change by identifying which engagement domains or which inclusion factors to target for improvement. So again, you don't just have some overall composite score that you don't know what to do with. You get scores by inclusion factor and engagement cluster, which I'll discuss in just the next slide. But it allows you, again, to pinpoint resources. So you might need to, you might be doing well in one factor, but have opportunities for improvement in another. And so that's part of what we feel is the power of the DES, that you can really pinpoint areas to really focus your resources in. So these are the inclusion factors that we measure in the DES. Respect, of course, nobody ever calls me except during presentation. Wonderful. Please forgive the phone ringing in the background. So, and a spam risk, isn't that lovely? All right, so there's respect, common purpose, trust, appreciation of individual attributes, sense of belonging, access to opportunity, equitable reward and recognition, and institutional cultural competence. And the idea behind these inclusion vectors is that if they exist, then you have an organization that appreciates and values the individual. So let's get a little bit more specific about what these factors mean. So common purpose. By common purpose, we mean that the individual experiences a connection to the mission, vision, and values of the institution. So they feel like they are a part of where the institution is going, what the institution stands for. Access to opportunity. By access to opportunity, we mean that an individual is able to find and use support for their professional development and advancement. So they feel like that there is some kind of trajectory for them. It's not a dead end. They actually have some place that they can go to further their career in that institution. Equitable reward and recognition. Now, this is an interesting one because this tends to be one of the inclusion factors that historically is low. And that is the individual perceives that the institution has equitable compensation practices and non-financial incentives, so people are being rewarded the same way. And I can tell you historically across all of the iterations of the DES, not just at UMass Chan, but across all of organizations that have done the DES, that tends to be one of the lower inclusion factor scores, where people just don't feel that is the case. Cultural competence of the institution. With this factor, the individual believes that the institution has the capacity to really use its membership in a way that meets the business goals and achieves the mission. And by using its membership, I mean really capitalizing on the unique experiences, unique cultures, unique backgrounds, points of view that your members have. Trust. By trust, we're getting at whether or not the individual has confidence that the policies, practices, and procedures of the institution will really allow them to bring their best and full selves to the organization. Sense of belonging. By sense of belonging, we're trying to measure whether or not the individual is experiencing their social group identities being connected and accepted in the institution. Appreciation of individual attributes. This is a factor that is aimed at determining whether the individual feels valued and can really navigate the institution's structure in their express group identity. So they don't feel any barrier based on however they self-identify as to really being able to navigate in the institution. And respect. The individual is experiencing a culture of civility and positive regard for their diverse perspectives, ways of knowing and expression. So those are the inclusion factors that make up the DES. We have 22 items that are spread across those inclusion factors, questions that specifically are aimed at trying to really capture information about those inclusion factors. Now, just been talking about inclusion factors. So how do we marry this with engagement research? So the way we do that is that those inclusion factors cluster into these 3 engagement domains. So the appreciation of individual attributes and respect cluster into what we call an appreciation domain. Common purpose, access to opportunity, equitable reward and recognition, and cultural competence, all clustered into what we call the vision purpose domain. And sense of belonging and trust cluster into what we call the camaraderie domain. So I mentioned that the DES is 22 core questions that are really on, then it's a Likert scale. So I apologize for that saying multiple choice. It's a 5-point Likert scale. You have one open-ended question, which allows the respondent to give a full and meaningful answer of whatever they want to say. And I can tell you when people answer this question, they really answer it. They give names, dates, times, geographic locations, whatever. They tell you everything when they answer that question. And many times organizations will either use that information to follow up on specific information that's provided to them. They'll also use it qualitatively and do a kind of formal qualitative analysis for that. We also have 10 core demographic questions that I'm going to talk about in just a second. But on average, it takes respondents 10 minutes to complete the survey. So it's a really low burden to take the DES. So the standard demographic categories that we ask are primary position at your institution, length of time, generational age group, race, ethnicity, gender, sexual orientation, religious belief system, primary language, veteran status, and disability status. Now, organizations can customize these demographic questions however they like. What we ask that they, if they do decide to customize, that they customize in such a way that it can roll back up to the way we originally asked. And the reason why we ask for that is because we provide benchmarks in all of these categories. So you can compare what faculty at this organization feel like compared to faculty in the benchmark. You can compare what people who self-identify as being have English as their primary language compared to the benchmark, etc. So that's the reason why we require that, and we're pretty dogmatic about that. Again, we don't limit what demographic questions institutions can ask, nor do we limit how best they feel those questions should be structured. However, we do work with organizations to make sure that we can roll back up, like I just mentioned. So the open-ended question I just mentioned, that that it again is meant to really encourage a respondent to tell us what they want us to know. And like I said, people use this qualitatively. They use it just, again, reviewing what's been said and whether or not there are actionable things that can be done. So, development of the DES. So it was never our intention necessarily to actually commercialize. And I guess that's one thing I have not said. The DES is commercialized. So this is not just a survey that we developed that UMass uses. The DES is used across the country and actually internationally. We've had numerous groups, even outside of academic medical centers, that have adopted the use of the DES. Many professional organizations now are starting to use the DES as well. So Debbie Plummer, who was the DIO office director at the time, was charged by Chancellor Collins to develop a survey that was actionable, not one that we would just say, oh, that's great, we did the survey, that's the results, and then put it up on the shelf. He wanted something that was actionable. And so based on her background in her professional consultation work, she convened a group of people that included myself, Greg Jordan, Jerome Allison, Lisa Fink Ogawa, who was here at UMass at the time, as well as Laura Castillo Page, who was the Senior Director of Diversity Policy and Programs and Organizational Capacity Building at the AAMC. Sarah Conrad, who was a senior research analyst at AAMC, and Mark Neve, who was the Chief Diversity Officer at the AAMC at the time. And so this group developed the DES. One thing that Dr. Plummer convinced the chancellors that we needed benchmark data. Like I said, after you've seen one academic medical center, you've seen one academic medical center. And so in collaboration with AAMC, we actually offered the use of the DES to 13 other academic medical centers. And so that's how we ended up with our original benchmark data set, which had close to 14,000 respondents in it. So in the paper that I showed there, that was published in Academic Medicine, we established the face and content validity of the instrument, as well as reliability of the instrument. So talking a little bit about how we actually administer the survey. We have two formats that we offer for the survey, which is full administration and a licensing only option. So UMass Chan always does full administration. And by full administration, that means that we do everything. We do the hosting, we prepare the survey in collaboration with the DIO office. We launch and we do all of the analysis and prepare reports. We also, maybe in the last 3 years, developed a licensing only option that was for institutions that possibly either had the infrastructure to be able to do all of that for themselves, or they didn't have the funds to pay for the DES, because we do charge for the DES. We charge for both options, but the licensing only option, as you can imagine, is much more cost effective for groups that possibly don't have a full budget to be able to do the full administration. The survey typically is open for 4 weeks. And so that's what you've experienced at UMass Chan. Sometimes we keep it open a little bit longer if we are not meeting the response rates that we kind of a priori set up as what we want to achieve. And then we usually give reports out 3 to 4 weeks post the close of the survey, depending on the amount of customization that is required. So we produce institutional benchmarking reports that give a demographic breakdown of results. So every institution that does this gets per question, overall, and by demographic category, comparisons to the benchmark scores for all of those things, calculation of inclusion factors and engagement cluster scores with comparisons to benchmark data. And within the last year, we've also started providing an executive summary that goes along with that voluminous report that I mentioned, because sometimes people get a little overwhelmed with all of the numbers. So we try to digest it and put together an executive summary that has been met with a lot of praise. So anonymity, how do we protect anonymity of responses? So what we do is we have a statistical threshold for anonymity, and that is 10. So any response that would have less than 10 or less, or I should say less than 10, we suppress that in the actual report. Now, every institution gets all of their data back. So it is the duty of the institution to make sure that they are not going to, if they do additional analyses, report anything that could potentially disclose and cause a problem with anonymity for the respondents. So just to give you an indication that, again, the DES is not just something that's done by UMass. The DES, this is a map, but basically of where we've had DES administration. And as of today, we've had 83 completed administrations across 66 institutions. We've had over 150,000 respondents to take the DES. That's just in full administrations. Then in licensing administrations, as of today, we've had 11 concluded agreements with their data return, 10 that are currently underway with open licensing agreements. All of that data will be returned to us as well. The reason why we have a stipulation that we retain all data. Now, obviously, any institution does that. They own their data. They don't have to ask us for any permission to do anything with their data, but we do get a copy of their data back so that it can be included in future benchmarks. So we're trying to kind of maintain the integrity of the benchmark, et cetera. We mentioned that the original benchmark had about 14,000 respondents across 14 institutions. The benchmark is updated typically every 3 years. It was updated in 2017 and again in 2020. It's due to be updated again in 2023. Our benchmark data set has 80,000 respondents in it from 50 institutions across the country. Now, the reason why it doesn't have the full number that I just reported that we have who have taken DES is that one thing as a rule that we do is that if an institution has taken the DES more than once, we only use their most recent administration in our benchmark, because we don't want one institution to unduly bias the benchmark data set. So examples of the DES in use, and I just pulled, I don't normally disclose who's used the DES. However, if they disclose, it's fair game. So these are people who have disclosed that they have used the DES by providing this information on their website. So this was a presentation at an international conference on residency education, where they produced results from their use of the DES. Emory University has on their website their results from the DES. Texas Tech University, a health sciences center in El Paso, again has produced this. I can share with you UAB, University of Alabama at Birmingham, University of New Mexico as well, because they have they've given testimonials in AAMC literature. I'll show you the brochure that we have for the DES. They've also published on the DES. So this is just a couple of examples. One from Jaya Asolo, who is at the University of Pennsylvania, who has published on the DES, as well as a group from, I believe they were from Canada, who used the DES in indigenous populations. So that was really interesting and great to work with them in implementing the DES. So we have, like I said, we do this in collaboration with AAMC. So this is actually official brochure co-created by UMass and AAMC, primarily AAMC, who has this brochure. And like I mentioned, Mona Fuad from the University of Alabama at Birmingham and Valerie Romero Leggett, who is at University of New Mexico, were some of the early adopters of the DES. So UMass Chan, and I won't go through all of these slides because this is kind of some of the results from the last iteration of the DES at UMass. I primarily presented to show that this is kind of something that we do, by we, I mean my group does as service to the institution to prepare these kinds of reports to the DIO office. And we typically produce them by not just overall for the institution, but we also produce them by business unit and by key groups and share them with the groups that need to know. So the last iteration of the DES was done in 2020. So as you can imagine, we're headed toward doing it again in 2023. And I believe this is part of kind of the lead-in and preparation of the institution for the 2023 administration. Like I said, the institution has done it faithfully every 3 years. So beginning in 2011, which was the first time the institution did it, we've done it every 3 years. And that's really kind of the pace that we recommend institutions do it at. It's every 3 years, because you want the opportunity to not to get results back, as well as to be able to digest those results, formulate a plan, implement the plan, and then have the opportunity to see if you've made significant movement in the organization. I can tell you that there are several organizations who have really basically, based on the results of the DES, completely blown up their systems. They have, went back to square one, revamped what they did as it relates to diversity and inclusion efforts on their campus. And they have seen appreciable changes, really some that were kind of almost staggering. And there is one in particular, I work with them on some of their analysis, and they have a manuscript under review right now that really talks about what they did. And hopefully they will be able to discuss what they did in one of the future events that our DIO office is putting on. So that's a plug for showing back up to that conference that I believe is coming up October 25th. So gave you a shout out, Angela. So all right, so this is kind of what our response rates have looked like over time. Here's again, I'm not going through these results for the purposes of you digesting them. I just want to show you the kind of things that we provide So these are results from the last iteration in 2020 across the business units and positions that people have in the institution. Length of time, generational age group, gender, gender identity. We cross gender and identity together, as well as sexual orientation, race, ethnicity, veteran status, and disability status. Now we have several ways that we present data. We found that by combining data, combining strongly agree and agree to a group that we call favorable, it makes it sometimes a little bit easier to digest what's going on. But the official data that we provide in our reports include kind of comparisons to certain tertiles and quartiles. I don't want to like make your head spin with too much statistical jargon. So for the purposes of presentations like this that we prepare, we simplify it by grouping strongly agree and talk about favorable. So favorable responses. So so here's we show kind of where the benchmark is on their feeling of favorable feelings across all items, as well as where UMass was. And you see we're similar, we're exactly the same as the benchmark was for that. And then we actually show, we produce across time where we are. So, you know, we started off very favorable, kind of went down, which is expected after you do a diversity, any kind of diversity survey. It always goes down because people are like, hey, I didn't think about that. Now you're making me think about things. And so it typically will go down, but then you see it's kind of started trending back up. We also produce that by business unit. So again, you can see if there's certain groups at the institution that feel less favorable than others. We do it by position at the institution, and we can show change from the last time. So you see, for example, here's some that went up from 2017 in executive leadership and for staff, but it took a big hit in students over 3 years. We do this by all of the demographics. So the length of time at the institution and how it compares to change from 2017, whether a person identifies as having a disability, by race, ethnicity, by gender, by sexual orientation, by age group. We also do it by vision, by inclusion factor, like I mentioned before, and we compare it to the benchmark. So here, for example, UMass respondents had a higher favorable rating on the common purpose factor than the benchmark did. Here, for access to opportunity, we had lower favorable rating to the benchmark, but our lower rating was still an increase from the previous time that we've done the survey. We do that by each of the, I told you about equitable reward and recognition. So you see, equitable reward and recognition historically is one of the lowest favorable rating factors. But if you notice, we are at 61%, so we're below the benchmark, but the benchmark itself is low in this category. So it's not like the benchmark is at 80-something%, but UMass is only at 61%. And that 61% is almost a 2-point increase from 2017. We do this by trust, sense of belonging, appreciation of individual attributes, and respect. So one of the other things that we do is we do by questions. So, and again, this is something that we do for UMass. We don't do this for everybody. other folks have to pay us to do this, but we do this for free for UMass. Okay, so this is these are the questions that are the highest rated favorably. And so, for example, I feel that my work or studies contributes to the mission of the institution. That's the highest favorable rating, followed by someone at work, school seems to care about me as an individual, and in my institution, I experience respect among individuals and groups with various cultural differences. On the flip side, we also show the lowest favorable responses at the institution. So the lowest ones were, I believe my institution manages diversity effectively. And here we also show you what the benchmark was for that. And in my institution, I am confident that my accomplishments are compensated similarly to others who have achieved their goals. And we also show the benchmark value for that as well. So then, again, because this can differ by what organization you look at. Now, this is kind of where some interpretation comes in. And so usually what happens is, okay, I see those first set of slides. And so the researcher in me starts to kick in, and I say, okay, what should we look at analytically to really kind of better understand what might be going on? And so this is where we produce some of these kinds of things. So looking at the highest and lowest rated items, we look by race and ethnicity, and we can see kind of if that's consistent across all self-identified race ethnicity groups, as well as showing what the benchmark looks like for that. So so we looked at both the lowest and the highest. And if you notice, for example, even with the overall low scores, you see that some groups have even worse feelings of favorable feelings in those categories that could have been obscured if we didn't look at that. And finally, based on everything, we usually try to pull together a set of conclusions that are based on that. So that is the DES kind of in a nutshell. And I think I've been looking at my watch to make sure, hopefully I have given time for people to ask questions. And so I'm going to ask Angela or Lynn or Marlena, however they want to facilitate questions. Check in.
Thank you so much, Sharina. It has been really informative and has answered a lot of questions and cleared a lot of things up. So we really appreciate your time. We're going to start a session of Q&A. So if you have questions, maybe you can put your little hand raised thing. Oh, we have John Irwin here. You want to start us off?
Hello. Hi, Sharina. Thank you.
Hi.
This has been great. I've always filled it out, but never really thought about how it was developed, and I never knew it was used by so many others. I wonder if, as more and more people, both here and in the other institutions that use it, work remotely, I wonder if there's been any thought to adding a demographic category of where the person works, because some of these things I would think are difficult to measure if someone's working remotely, like a sense of belonging, camaraderie, trust, respect, connection to the mission. Any thoughts of if we might see changes in some of those scores? Again, because I think it would be, just my own personal, I'm thinking it would be hard to feel connected to the mission if you're sitting at home, you don't, and especially if you were hired and have worked remotely in all your time at UMass. When I come to campus, I pass the new NERB, I pass clusters of students, and that kind of, I think, gets me connected to the mission. Obviously, my work itself is connected to the mission. So any thoughts on the working remotely impact that there might be on the results?
That's a really good question. So I would say that additions of questions. So let me go back. Additions of demographic questions, I think, will be under the purview of the DIO office, because I serve as a vendor in this sense, so I don't really control what's included. I think what you bring up is a good point, though, and in fact, it is kind of the basis for a line of research that we're working on kind of separately for the DES that deals with workplace stress, feelings of inclusion, and engagement, particularly in this post-pandemic society where you have a lot of people who are working from home. And if the that change of locality has any impact on feelings of inclusion and engagement. So I can tell you, my research team is working on that separately, but I think it's a good point, and the people who make all the decisions about what will go on the DES are here, and so they have heard you lodge that suggestion.
Great.
I'll ask a quick question and embarrass myself by admitting that I joined a little bit late, so I apologize for that, but it's very nice to see the DES data again. Dr. Person, thank you for walking us all through it. I am curious if we're going to be conducting the DES survey again at UMass Chan, and if so, when? And I'm sorry if
so this is our kickoff to start talking about the DES survey. So we hope to administer it again in the spring. So that will be the next round. And so we're going to do a series of conversations. This was the first one. The second one will be other institutions that use the DES and how they've utilized the data and improvements that they've made. And the third is really to talk about UMass. What are some of the results we've seen? What are some of the changes we've made? And then what do we hope to learn this time? We see that in terms of our response rate that fluctuates. We don't have as many students taking the survey, so we really do want to ramp this up and make sure that the institution as a whole engages in taking the survey, and then collectively we can work towards the areas where we have low scores, or we just want this to be a meaningful tool. I think we have a lot of information here that we haven't utilized to the full capacity, and so I think that we really have a great opportunity. This is a homegrown tool, which I'm very proud of. Really glad that we have Sharina to work with. So just want to make sure that this next time around that we utilize the tool.
Thank you.
The floor is open for more questions if you have them.
Sharina, one thing that typically comes up when we're discussing any kind of climate survey and increasing engagement is confidentiality. I think there are folks who are always worried about the responses being linked to them. And I know you said that it's a summary, particularly if there's a department that has less than 10 people, if there's less than 10 respondents. Can you say a little bit more about what else happens, just to kind of address some of those concerns regarding confidentiality?
Sure. So we use a third-party vendor that actually does the infrastructure of supporting the DES. So the link comes from the DIO office, but the actual storage and analysis of the data happens externally. They have all of their HIPAA assurances and security assurances in place, very stringent bar that they have met to be able to handle this. We don't have what we call tiebacks, so we are not linked to an IP address. There is no way directly to know who's answered what. So unless you start to really purposely try to identify who a person is. So, I mean, I'm not going to try to give the impression that a person is not identifiable. No, for example, if although we don't ask for department now, that may be something that we will ask for. But if you now this is not a report that comes directly out, but in the actual raw data, if someone says that they're looking at PQHS and they're looking for a full professor and they're looking for African American and they're looking for a female, you probably can guess that's me in my department, okay? But more than likely, the people who have access to that data are not trying to get at that. We're not trying to, no one, UMass gets UMass's data. Nobody else has UMass's data except my office. We're not specifically digging down to that because that is that's the sore spot for me as a statistician. First and foremost, so I want to always protect anonymity of data to the best of my ability. So I can guarantee that every effort is made to really maintain anonymity. One thing I will say is sometimes institutions have incentives that will try to increase use of the survey. So for example, you could get entered into a drawing for something if you fill it out. Well, what we do in that case is that if you say that you would like to be entered, you go to a totally different site that is not connected to your data at all. And this other site only captures your name and information that you have self-selected to enter. So it's not connected to your data. There's no way to put it back with your data that way. So.
Thank you.
I think I see a hand there, Josh.
Okay.
And Clarvinder?
So I'm wondering whether you ever try to get at the question of how things are at UMass versus how they were at a previous employer for the individual who's answering the question. The reason I bring this up is it is useful, I think, to know, and this is not my area of expertise, to know why somebody is staying here at UMass. Is it because of the atmosphere? Is it because of the money? Is it because they can't get any other job? But I think that's an important thing to know about in order to improve the ambiance, especially when it comes to retention.
Yeah, that's a great question. We have not thought about that specifically for incorporation in the 22 items that make up the DES. That being said, quite often institutions as well as UMass Chan have added additional questions that they have asked to help contextualize kind of results. And so that may be something that they decide to include as an additional question. So I'm sorry, Parvinder, I missed seeing you with your hand up.
No problem. Thank you. Actually, Josh had a better question, but so I have a good, thank you, Sharina. That was a good presentation. So I have more of a statistical question. I think it's slide 7 or 8 about the DES function. So you have taken care of 3, like descriptive and prescriptive and diagnostic. So with the prescriptive, you already have shown us that how it improvement part. But why we are not including predictive? What happens? The information we already have since 2011. So what we know right now, what if we don't do anything? So won't that be also something interesting to know? So why we are skipping? My question is, out of those 4, why we are skipping predictive and keeping the other 3?
So predictive requires an assurance that the institution takes it again, right? That's how we can develop predictive models. We have to have a pre and a post, if you will, or we have to have some kind of some measurements made on a continuum. We are, perhaps it has not been our focus per se, but we have now kind of in the 11 years that the DES has been in existence, are getting to a critical mass now where we have enough data that has been done longitudinally on enough people to do some predictive modeling. So that has not been our focus. That doesn't mean that it can't be our focus. We can't make it one of our areas of focus. And we do have, data from UMass over multiple years so that we could do some predictive modeling. I can tell you that this has been a homegrown system, if you will, in the sense that this wasn't originally our plan. And so I didn't have the infrastructure to do a lot of this kind of additional modeling, all of the stuff that like gets my juices flowing and, fulfills my inner geek, because we've been trying to just keep the instrument going all of this time. We've gotten to more of a critical mass with infrastructure and staff now, so we can start to do some of the cool stuff that you mentioned. So I'll definitely put that on my list of things to look at.
Thank you so much.
And that was a great question.
Thank you.
And I think someone asked if the slides would be available, and I'll definitely make them available to the DIO office to distribute however they like.
Awesome. Well, we have reached our 1 o'clock hour. Thank you again to Sharina and to all of you for attending. We hope that you will attend our 2nd and 3rd sessions. Keep an eye out in our Up Next for the next ones. And we hope you have a great day. Bye-bye.